Hi, my name is Samir Becic and I am here to conduct interview for Health and Sport magazine with Mayor Annise Parker. We're here to talk about Houston Health Initiative. We are very honored that Mayor Parker gave us exclusive interview out of her busy schedule. Mayor Parker, thank you very much for giving us this time here. I know you're very busy running the fourth largest city in America, and some say even third largest city in America.
Oh, it's only fourth.
It's only fourth now.
We're growing, so.
We're working to be number 3.
Yeah.
Excellent. Now, I have some questions for you. I'm here with the Health and Sport magazine, and we heard about your great initiative, Houston Health Initiative, our Healthy Houston Initiative.
Yes.
And we're really excited about that because we definitely promote healthy lifestyle. Now, Mayor Parker, I have a first question for you. Given that Houston has been one of the fattest cities in America for a decade now, and actually 12 years, what finally motivated and provoked this idea about Healthy Houston Initiative?
Well, first of all, Houston is not the fattest city in America. That is a completely unscientific, not backed by any empirical data label. It was assigned because Houston happens to be a city with a huge number of restaurants.
Makes sense.
And not a lot of gyms. Well, the reason that we don't have a lot of indoor gyms is that we have a climate that allows outdoor activities 12 months of the year. Now, it gets a little hot here. You sweat a little bit in the summertime, but we're out and about. But even though we know that those kind of labels are meaningless, it's important to me as mayor that our city is as healthy as it can be. It saves money, it saves resources, it alleviates the strain on our medical facilities because most of the health problems we have here are preventable. I actually started this initiative inside the city. We changed healthcare providers in the city last year, and we switched to a company that promised to engage us more in a wellness model than a disease treatment model. And as part of that, every city employee had to take a health assessment and begin to go down a path of being healthier, whether that meant controlling blood pressure or losing weight or more exercise or stopping smoking. If we're going to do it for our own employees, how can we engage the larger community? And we think the time is right. The world has changed a little bit since I know Mayor Brown launched his initiative. There's so much more information out there, and there's so many more people everywhere, but particularly Houstonians who want to be more fit.
I agree with you, Mayor Parker, and I'm aware of that, that they base that on the restaurant count and how many gyms we have and how many actually fast food restaurants. That's a key component, fast food restaurants. And believe me, fighting Houston obesity for the past 12 years that I'm here in Houston, I'm definitely agree with you 100%. Houston is definitely the best city for me.
Yeah.
What kind of programs do you plan on implementing to increase physical activity in schools and at work and communities? You already answered that part.
I answered it a little bit. I don't really have any direct input into schools, but the city operates a large number of the after-school programs. And a component of those has to be getting kids and getting them moving and active. And those are conducted through the Houston Parks Department. We are providing more and more opportunities for Houstonians to have access to outdoor activities. We're expanding our park space, and if the voters of Houston support the bond election this November, we will be able to implement what we're calling the Bayou Greenway Initiative, which will mean we have a linear trail system along every one of the bayous that comes into the city of Houston. It'll vastly expand our hike and bike trail system. We're also doing things like our B-Cycle bike share program. It's only downtown now, but we intend to expand it into the museum district, the medical center perhaps, where if you want to purchase a membership, you can go down, pick up a bicycle, and be on your way in just a few minutes, and you don't have to either own your own bike or you don't have to trek it with you, when you come downtown in the morning, but you still have on your lunch hour, if you want to go take a trail loop, you can do that. And so we're constantly looking for ways to get more people moving. I work out twice a week with a trainer and also work out privately at home. I started that, it's actually been 1 year this month, because of a health challenge from the Houston Women's Chamber of Commerce.
Okay.
Women CEOs getting healthier. And it hasn't been the most fun always, but I certainly can tell the difference.
Mayor Brown started something in 2002, and actually it had some success. Now, you answered partially already my question. How can we make this initiative actually much better, much stronger?
What we don't remember is the amazing growth in social media. It just really wasn't there. And there's Facebook and Twitter. There are apps that help you track your calories and track your steps, and you can, one of the hardest things if you're working out is to do it by yourself. It's always better to have a buddy. You can now have an online buddy, and you can track each other, and you can be in different parts of the city but know what the other one is doing physically. There's so many more tools and
I agree with you. I agree with you 100%. Right now in the last decade, we definitely have social media that can help us spread a message about healthy lifestyle.
There's also I think a different awareness.
I agree.
Part of that, social media is more a young person's thing, but as I'm a baby boomer, and as we are getting near the end of our business careers and we're looking at, 20 years perhaps of the next phase of our lives and an increasing lifespan, what are we going to do with it? We are much more interested in being healthy as we get into that.
No, that makes sense, especially right now that they're saying that the CEOs that at this point of time, 65 and 70, they don't have a replacement yet. So we definitely want to make them healthier and fitter before the new generation doesn't come. Now, Mayor Parker, one more question. Now, we do have the biggest and largest, and I hope the best, medical center in the world. Now, at the same time, the rate of obesity in Houston increased to epically dramatic proportions. Now,
that's really what finally prompted me to restart the Healthy Houston program again, because so many of these diseases that we're suffering from are preventable and treatable on our own without medical help.
I agree completely, 100% with that. Mayor Park, at the same time, the medical center in the last 2 months came with the information that they will start changing. Why do you think? Do you think that medical doctors don't have enough knowledge about healthy lifestyle, or you think they don't provide enough information to the patients and public in general with the preventive medicines instead of the medical treatments?
I think preventive medicine is coming into the forefront, but what we have now is a convergence of a lot of different things happening socially, happening in medicine, the opportunity to share more of this information with each other, and respectfully to the medical center, which I believe is the largest in the world and I believe the best, it is often composed of specialists who are focused on that disease treatment and a certain field. And we really need to be thinking of wellness and how to stay away from doctors until we truly need them, and not wait until we need to be cured of something.
I love that statement, Mayor Park. That's an excellent statement. I support it with all my heart and soul. We have for example, police department. We have teachers. They're very stressful. They have stressful jobs. They, working with the children, working with the criminals, and that's a dangerous and stressful job. Do you think implementing healthy lifestyle and preventive medicine into especially those two fields could increase our security to the next level and make our teachers more flexible and more focused and more task-oriented to create a new future, new generation of successful and healthy children?
Yes. The short answer, I can stop there and say yes. I hope that more employers like the school districts offer the kind of options that we're now offering in our own health insurance system for the city that encourages employees to get on a wellness track. But specifically to the police department that you mentioned, in our last contract with the police, we put a fitness requirement in for officers who are hired after a certain date. Officers come out of the academy very, very fit. Many of them in the most fit condition of their lives to that point, because there's a lot of physical training that goes on at the academy, and then they stop. And with our last few years of officers, there is a fitness requirement that will follow them through their careers, and I'm very excited about implementing that. And we did it in such a way it's, again, motivational and positive rather than punitive. But if you don't meet the fitness standards, you might not get that assignment that you want.
That's definitely, wow, that's very good. I had an interview with Dr. Deepak Chopra earlier this month, and he stated that 90% of all illnesses can be treated with a healthy lifestyle. That means 90% of the genes actually can be manipulated in a positive way through healthy lifestyle and exercise. What is your stand on that?
Well, I don't know if it's 90% or 70% or what the percentage is, but I know, and there's no doubt through all the scientific literature that much of what we suffer from, the ills of modern society, are from a sedentary lifestyle and poor choices in eating. That's also why the city of Houston, in addition to all the things that we've talked about, for the last couple of years, we have been driving a healthy food, locavore, better food options program here in the city. Houstonians love to eat, and I recently began my own thing that I'm going to the restaurants and I pick up always the healthiest food option, and I promote that on Facebook. I wish I could say I always pick up the healthiest option when I go to a restaurant.
See, that's my job, Mayor Parker, so I choose that as my excuse. Okay. But I also advertise that on my Facebook and everybody who reads my articles and sees me on TV. Now my question is, how can we motivate restaurants in Houston, or in Texas for that matter, to promote healthier food options, or at least to have a certain amount of healthy food options for everybody who comes to them?
Restaurants are service organizations. And restaurants, particularly, we are blessed in Houston with a huge variety of chef-owned and chef-driven restaurants. A chain restaurant is a little more challenging, but we have a lot of locally owned and operated restaurants, and they need to, the restaurateur needs to hear from the customers what they want to see. And we should not be shy about looking at a menu and saying, "Hey, I like this. Could you take the sauce off?" For example.
So we should be more picky.
Or hey, I see that this comes with French fries. Do you have a green vegetable, or could I have it with a salad? Instead, ask. And if enough of us ask, I guarantee you that those menus will change.
I agree. If we have enough demand, if they have enough demand, they'll definitely change. I started in January of 2012 Healthy Fitness Revolution here in Houston, that is trying to implement healthy lifestyle, physical activity, and proper nutrition to Houston families and communities. How does my organization and organization like mine can actually help Healthy Houston Initiative to make it to be even greater success?
Just got Healthy Houston as an organization off the ground, but the city, as I said, we already had a number of initiatives that I think would fit in very well with the kind of things you're doing. Our Community Gardens initiative. In fact, if you walk out of City Hall, you can walk right across the street and see our Victory Garden, And you can walk the other way across the street and see the container gardens outside of our Public Works building. Interestingly enough, when we started the container gardens, part of the goal was just to show how easy it is to grow vegetables. If you can grow a vegetable in a giant cement pot in front of a downtown office building, that's like growing a vegetable in an oven, because it gets hot, and it just the winds sweep around the buildings and so forth. But what we discovered is that in addition to actually growing things, because you know there's a lot of people involved in those keeping the pots alive and the plants tended, that instead of going in and getting a soda on a coffee break, they would come down and tend the plants. And they built relationships around a healthy activity, and it created completely different connections. I mean, we see people coming outside of an office building and they go and have a smoke break. These folks were coming down and having a gardening break, and we hope that they actually go home and it inspires them to do that at home. All of these things we need partners in. We're doing a community gardens initiative across the city. We've been encouraging people to grow their own vegetables. We're also working on a food desert initiative. We know that a lot of folks don't have access to healthy choices in the commercial grocery stores in their neighborhoods, and so we're trying to bring more and different types of commercial grocery stores into neighborhoods. But if we can get a neighborhood garden going, if you don't want to grow you don't have enough dirt, or you don't want to grow your own food at home, we can show you how. And we're always looking for partners who want to be a part of those kind of initiatives.
Wow, everything what I heard today is definitely positive, and I'm really excited about that. I'm glad that after the Mayor Lee Brown started something, and then we had a big gap for like several years, and now you're coming very strong, Mayor, and that strength really shows, because everybody's excited. Everybody's talking about Houston Health Initiative.
I have a full-time person who happens to actually be watching this interview today. I have a full-time person whose title is Sustainability Director for the City of Houston. Sustainability includes water conservation and energy conservation and green buildings, but it also refers to these range of activities to make our whole community healthier and more sustainable.
Mayor Parker, what do you do for fun? You work a lot, I see it.
I have a garden. I actually have a very small garden plot in my backyard. I am a plant person, so I used to be a cactus hobbyist and an orchid hobbyist. I don't have time for that much anymore, but I still have a lot of the plants, and I garden and I read.
Reading, wow.
And I like to walk.
So you like to work out?
I'm not a jogger. I walk. In fact, I have exercise equipment at home. I have a treadmill, I have a stationary bike, and about the only TV watching I do. That's part of the deal. I'm almost never home to watch TV, but if I'm watching TV, I have to be moving.
I see.
Pedaling,
So you believe in physical activity, healthy nutrition, and building your mind, and that's for me. That's the definition of health. For me, definition is health if you have a physical activity and a proper nutrition, but if you don't have the mental part of it, something will be missing. So, complete health. Mayor Parker, it was a pleasure talking to you. I'm looking forward for our next interview. I promise you I'll be a little bit harder on you, but
oh no, wait!
Just a little bit harder. But it's definitely whatever Health Fitness Sport Magazine and Health Fitness Revolution can do to help Houston Health Initiative. Will definitely be more than glad to do that. Thank you, Mayor Parker. Appreciate it very much. Okay. Thank you.